My name is Virgil Mathewitz, and I'm the faculty advisor of a student project at the university called The Effects of Meditative Movement for Persons with Chronic Conditions. And it was about a year ago, right? Ellie Peterson contacted me and asked whether I would be willing to help her evaluate her course, her intervention with clients here at Pathways. And it turned out it was an opportune time because I was looking for a new project, and so we decided to go for it. So a little background, complementary and alternative medicine is becoming more commonplace in treating people with chronic health conditions, and meditative movement is one category of that. And there's some evidence in the literature that they have beneficial effects for different people and for some different outcomes. But Ellie has sort of a unique version of meditative movement that incorporates positive affirmations. And so the question is whether this unique version of it is effective, first of all, and ultimately down the road maybe whether it's more effective than some others. So the purpose of the study was to do that, was to evaluate it in a simple pre-test, post-test follow-up study. So there's no control group, but it's a good place to start with a new intervention when there's been no research done. That's a good method. And measures, or how we evaluated the intervention, we chose the Beck Anxiety and the Beck Depression scales, and those measure obviously anxiety and depression. The functional assessment of chronic illness therapy fatigue, which is a measure of fatigue, and the functional assessment of cancer therapy general, which is the FACT-G, is what I would call a quality of life measure. And that's a broader overall kind of health and well-being. And then we thought it might impact blood pressure. And so we measured both systolic and diastolic blood pressure. And then the last thing was the goal attainment scaling, which was that individualized thing. So what happened? Well, we ran statistical tests. We had to use non-parametric because of the small sample size, which is less powerful. So what happened? Well, we were a little surprised in from pre to post test, where we expected to get change. We only got 2 items that changed. One was the fatigue scale, the fatigue scale. That improved significantly, or decreased significantly. And the emotional well-being subscale of the quality of life measure improved significantly. That was a little bit disappointing, but that was tempered by a surprise on the late-in. From post-test to follow-up, all the yellow items are the ones that were significant. And it included the Beck Anxiety Scale, the fatigue scale again, the overall quality of life, emotional and functional well-being, all changed significantly. So this is at the time where we were expecting really no change. So what's interesting is that it appears that the beneficial effects took longer to happen than we anticipated. We thought we would get them.
Yeah, go ahead.
Just say one more time the difference between the pre to post variance and the post follow. So this is a period of time after you measure the pre to post?
The pre was the first time they
Yep.
came. And then they had 7 sessions.
Yep.
And then post happened. And then we had 4 more weeks of what we call maintenance,
Oh, okay.
continued practice. And it was after that,
That's the 4 week.
that's
Okay.
where we got the bigger beneficial effects showed up. Okay? We did something called Cohen-Dees effect size, and that is a measure of change that is not sensitive to the sample size. And so for there, any number really above 0.5, 0.5 to 0.8 is considered moderate change, and anything above 0.8 is considered a large effect or a large change. And which that typically means is that things that are at 0.5 or above may not have been significant here. Let's take anxiety for, if it continued, would be really high.
Yeah.
And the depression scale likely would make it. Fatigue obviously did well already, and really well. So that's, of all of them, that, let's see, no, we have a tool right here. That was functional well-being. But that was the strongest and clearest benefit was on fatigue.
And so, just to clarify, so I understand Cohen again. That is,
It's a measure of effect size. So is the change from pre to post, is that a meaningful change?
right,
Is that a practical
Right.
difference?
but the difference
The
then,
bigger the number is, the more is, the bigger the change,
all right.
and the more important the change.
So, and the difference between the Cohen's pre to post and the actual pre to post is just takes away the sample size?
Correct.
Okay. How
Correct.
does it do that?
Um,
Or does it just say, had the sample group been 100 instead of 12?
Well, the stats here that we used, they all, when they look at the amount of change, they also take into account the sample size.
Oh, I see, okay.
That's part of the formula.
So it's sort of
So-
based on prior research outcomes in general, had this been a bigger group, theoretically, this would have been the real
Yeah.
change?
Yep, well, in this formula, they eliminate sample
I
size,
see.
it's not included. So it just looks at the change,
Okay,
the amount of change relative to the amount of variance. And so statistically, say at pre-test you have this, and at post-test you have this. The less overlap there is between the two, the more important the difference is.
mm-hmm.
If they overlap a lot, and it's a small difference, probably not important, could be error.
So you need to look at everything kind of in everything, but is there something in Cohen's that to you was just like, is it the fatigue score that seems to be the high?
Fatigue score stands out for sure.
Yep,
Now, even here, this is the FACT-G, the quality of life,
Yep.
for the post follow-up. I mean, this is above 1. And then we get down here, I didn't notice this one before. And again, that's the post follow-up of the functional well-being scale, which is, let me show you, I'll read to you the items from that one. People rate, I'm able to work, including working at home. My work, including work at home, is fulfilling. I'm able to enjoy life. I have accepted my illness. I am sleeping well. I am enjoying the things I usually do for fun, and I'm content with the quality of my life now. So that score improved, not from, let's see which one.
in the short
Not
term.
in the short term,
Yeah.
but in the longer term,
Which
it did.